population issues and environment issues.
Your talk stimulated a couple of very useful ideas for me. First is that you presented a very nicely designed approach to an extremely complex problem. And the design comes out of Catholic social thought. And there isn't anywhere else in the field of bioethics where there are structures as well worked out as within Catholic social thought. Bioethics is a pretty ramshackle business. And you get lots of good ideas, but very rarely structured in the way in which you set up that problem. And I really commend you for that. In a way, it's the way in which Catholic thought contributed to the very rancorous discussions between labor and management from the late 1800s, because we had a structure that was provided by the early encyclicals and so forth. And a second thought is perhaps more negative. The last question that was raised here about other religions. It seems to me that religion in the United States, at any rate, and by that I mean Catholics and Protestants and a little bit less Jewish, but Catholic and Protestant certainly, that there's a kind of a timidity in even approaching the issues of genetics and genomics. I remember 30 years ago, the leadership of the Catholic, Protestant, and Jewish worlds in the United States wrote a letter to President Carter expressing their great fear of genetic engineering. And with the recent stem cell issues, it seems to me that religious people have are very timid to approach questions of genetics, and it's not part of the dialogue at all. And what you've done today presents a piece that is not ordinarily done.
No, I agree. I mean, I think for one thing, religion tends to be reactionary, and the more that religious people believe that they're being marginalized from the conversation, I think the more reactionary it tends to be. So what you see sometimes, if you look at testimony before commissions and so on, is an effort to speak in terms that are private and textually based and inaccessible, and that's, I mean, there's a sort of value to speaking very clearly. There's certainly a value in terms of your own communities to speaking very clearly out of in the language of your religious tradition, but the downside is that you lose your persuasive ability. And it seems to me that one of the great virtues of Catholic social thought is its assumption that persons of goodwill can talk about these most fundamental issues together, and that you have a responsibility to try to find a way to talk about it that builds from your religious tradition but somehow extends out of that tradition into a broader social conversation. I think the other practical problem, of course, is that, again, because we have focused so intently on abortion, and our Catholic identity has become so bound up in questions of abortion, and because abortion has been used as a litmus test of various kinds and in various places, I think many people are reluctant to talk about genetic technologies because it borders on this larger question of abortion. Right now, if we're talking about eliminating a genetic disorder, we're really talking about preventing a birth. And so, even when I've dealt with hospitals, it's changing a little bit, because the Catholic Health Association has come out with, I think, some very good materials now, educational materials on genetics. But the first thing you have to confront with people is, well, we don't want genetics, and we don't want to really invest in genetics because that gets us into the whole abortion question. Well, then what you're doing really is you're leaving the field to the powerful. You're just giving it over. And so I think it's unfortunate that we've brought ourselves to that point, because there's a richness to not only what we want to say about justice and what we want to say about equality, but there's a richness to what we want to say about reproduction, and what we want to say about medicine, and what we want to say about health, and some of the most important concepts that we have today to use in medical ethics, like extraordinary and ordinary means, come from the rich Catholic tradition thinking on these questions. But a third practical question is that, if you're a Catholic theologian, you want to be very careful being pushed publicly into such discussions. And so there's a kind of chill factor that goes all the way down. And unfortunately, it lets everybody off the hook of needing to talk about these kinds of issues. And that's really the opportunity cost. Whatever the church may be accomplishing in terms of others staking a claim in terms of human dignity and other grounds, it's giving up its moral authority in many other places. And I think that's reflected in the absence of real discussion on healthcare, absence of real discussion on developing world issues coming out of the churches.
We want to thank you very much, and she'll be around for a little bit.